All right, welcome everyone to this panel discussion on public administration and careers in the healthcare sector. My name is Nathan Myers. I'm the director of the Master of Public Administration program at Indiana State University. And I'm here with a couple of graduates of the MPA program who, after completing the program, went into healthcare related careers. And I'll let them tell you more about that. So I'll have each of you introduce yourselves. So since you're both on Zoom, I'll go with the person who logged in first, which is Dan. So Dan, if you'd like to give people your name and your current position.
Sure, Dan Hardesty. I'm the Director of Government Affairs for the Indiana Rural Health Association.
All right, thank you very much. And Ashley?
Hi guys, I'm Ashley Hemrich. I am the Access Director for the Human Resource Center of Edgar in Clark County.
All right, thank you very much. I appreciate you both taking the time to participate today. I know you're both really busy, so the effort's really appreciated. So the first question that I'd like you to talk about is to just give some background on kind of your educational path and kind of your professional path as well, and how they led you to your current position. So Dan, if you'd like to start.
Sure. Thanks, Dr. Myers, for having us. Excited to be here. I think my educational path is probably similar to many people. I did my undergraduate work at Indiana State as social study education. I was going to be a social studies teacher. When I was finishing that degree up and did my student teaching, everything was going great. And then it was I wasn't really feeling the push to go into education at that point in time, especially since many of the teachers were telling me not to do it. So listened to them, took a year off, and ran into Dr. Bergbauer at Indiana State, who told me to apply for a grad assistantship for the MPA program. Learned a little bit more about the program, applied, and I received an assistantship, and then I entered the MPA program. And then while at the MPA program, Dr. Myers linked me up with the Indiana Rural Health Association, which I didn't know had an office in Terre Haute. And I interned for them during the MPA study period. And then after that, I worked at the Lugar Center for Rural Health, which is a part of Union Hospital that does very similar work as IRHA. And a year ago, in a couple of, actually on the 25th, it'll be 1 year that I've been Director of Government Affairs for the Indiana Rural Health Association.
All right, thanks very much, Dan. And Ashley?
It's kind of like Dan. So I've actually been in school the last 10 years. So I went back in 2015 for my undergrad political science with Dr. Myers. And then I was talking to Dr. Bergbauer. He mentioned the same thing to me as he did to Dan about, the graduate assistants. So I was actually able to be the graduate assistant during my master's program with Dr. Myers during very beginning of COVID. How I ended up in my position. So I didn't have any desire to be in healthcare, mental health care, anything like that. I ended up just falling into this position. My internship was actually with the HR department with Human Resource Center. And then the access coordinator position opened up right at the beginning of COVID. And I took that position, which meant I was in charge of the access for every individual coming into our services. So I was able to lead HRC out of, the pandemic, past our 600 wait list to where I am now, to where I actually just got my promotion a couple of weeks ago to where I'm now the access director. So I work closely with individuals in Edgar County, Clark County. I work closely with, so if you're an employee of the city of Terre Haute, I have EAP, Employee Assistance Program, with the whole city of Terre Haute, the police departments, things like that. So I kind of just ended up in administration and things like this in the social services field. I just kind of landed here. So that's how I got here.
Thanks very much, Dan and Ashley. So I'm gonna ask you to give a little bit more information about your different positions. And the first question I'll ask is, what is the most rewarding thing or the most rewarding aspects of your current position? So we'll start again with Dan.
Well, that's a good question. I was hired on this position, like I said, about a year ago, and it's kind of been building the plane as we're flying it kind of thing. There was somebody else in my position, but it hadn't been filled for quite some time because I think the association wanted to figure out what it needed. And so they've kind of given me the ability to kind of, do what I feel is best, or just throw out a lot of ideas and talk to a lot of people in the industry about how we can serve our members better. So there's a couple things that are probably the most rewarding, both personally and professionally. One, professionally, is there was a colleague I worked with at the Luger Center, our medical director. He'd been the prototypical country doc for years, for over 30 years, where people come in and they all know him and the whole town knows him. And he said advocating for rural health is the easiest thing in the world. Who wants to harm the country doc? Who wants to make it more difficult for them to do what they want to do, which is just treat patients. So with that, our members are great. I get to travel around the state and talk with them and learn about their rural communities and understand what their strengths are, what their opportunities are, or what they need help with. That's very rewarding for me. I enjoy that part immensely about my job. And then personally, and part of the reasons why I went into the MPA program in the first place is trying to figure out ways that I can help my own community, having the understanding of how kind of the public sector works and where opportunities to improve are, or especially like leadership in rural communities is desperately needed right now. So I think with that, I live in a rural community. I live just north of Vigo County and Park County, and we have our own challenges. So able to kind of anything that I'm able to do kind of a work wise that benefits rural communities also benefits my community and my family. And that's something that's very rewarding. It's kind of two birds with one stone.
Right. Thanks very much, Dan. And same question to Ashley, the most rewarding aspects of your job.
I would say, I've done a couple of these with you, Dr. Myers, and I would say it's still going to be the patient client aspect. Beginning of COVID, I was not able to get clients in. I had to tell people continuously, hey, I can't get you in. I don't have a therapist to see you. So my big thing is still going to be the clients. I've come to be really involved in the communities that I'm in. And so I can go to Walmart in either Edgar County or Clark County, and I have people say, hey, you're Ashley from HRC, or hey, you got me hooked up with this for my, my drug court, this and that. It's amazing how people are just willing to tell you that in public, by the way, but it's going to be the people that I am able to help. I get to help the people who don't want to help the other people. So individuals who are the worst of the worst. I have individuals who are, shipped down here from mental health hospitals, from, parole, everything like that. But I would definitely say hands down, it's the people, knowing I get to help people and that they're actually learning and, they're taking what I have and their success stories. So the people success stories, and we're able to hire these success stories too. So it's definitely the people hands down.
All right, thanks very much. So the flip side is the most challenging aspects of your current position. So we'll go back to Dan for that question.
Sure. And I should probably explain my position a little bit more. Like I said, we're kind of building it still, but I like to think of my position and each director of government affairs, it's kind of a common title across our type of association, across the industry, but each association is different. So you'll find that people do different things for different organizations. But for me, it's kind of understanding and developing strategies across lots of different buckets of opportunities for impact for our members on the government level. And the way I think about that is a couple of different ways. One is, like I've already mentioned, engaging with our members. They see my face, they have questions, about whatever rule or whatever law, or maybe they want to tell me about something that has been an issue for their facility. So I do that a lot. I also kind of spearhead our advocacy efforts for the association, meaning, different ways of engaging members with elected officials or being the face of the association when it comes to that kind of stuff. We also do a little bit of analysis of different policies and laws that are proposed. And then on the flip side, every chance that we have to engage with elected officials, I do that because I see my role as the conduit of our members to the elected officials. I also see it as I am the conduit that is between our members and our lobbyists as well, who do this on a daily basis. So since I work remote and I engage with our members, I'm not able to, be at the State House or in DC 24/7. So we have lobbyists that do that, and different associations that do that. So that's kind of my role in a quick nutshell. But so far, I think the couple of the challenges that I've run into, one is just keeping up. Obviously, the federal government is ginormous, and keeping up what they're doing is impossible. So you got to lean on different, obviously, different associations to help out with that, as well as I do a ton of reading. I read so much every day, lots of newsletters, websites, you name it. And it's not all healthcare related because it all is intertwined. So I just try and keep up as best I can. And then um, another challenge is not necessarily at the state level, since so many of our elected officials are from rural communities. They kind of understand rural communities, sort of. Probably not as well as they think, but that's besides the point. But on the federal level, getting people to understand rural is really difficult. You don't have to be from a rural community to understand the challenges of rural communities, obviously. But if you're from a rural community, maybe you do understand it a little bit more. But trying to convey issues to elected officials or agencies is really tough. And I recall one time I was at a conference in Chicago, and I was sitting at the table with somebody, actually, I think he was from the U.S. Attorney General's office. So obviously when you hear that, you kind of you sit up a little bit straighter and you start watching what you say. And he was like, yeah, we're investigating some telehealth companies. And I was like, oh, cool, whatever. And he was like, yeah. And he told me he was from Queens, New York. He was like, so they say that broadband is an issue in rural communities. Is that really an issue? I was like, yeah, like I can't get it at my house. He's like, what, really? So like things like that are definitely challenging, relating it to them. And then lastly, a big challenge, and this is industry specific in Indiana, is the discussion around healthcare in Indiana has been pretty contentious the past couple of years, specifically looking at the cost of healthcare. So that makes my job more difficult. So just educating a lot of people on that. But I think that those three are probably right now biggest challenges.
Thank you very much for that, Dan. Ashley, same question to you. The most challenging aspects of your job currently?
I'm gonna like piggyback a little bit off of Dan. It's really hard when you're in a rural community trying to get, like mental health and SUD services, and making the state realize that it's not a one size fit all type of situation. So I think a big part of it is one of the hardest parts of my job, especially in this area, is the laws and the policy and procedures, trying to make sure that, because things can change so quickly. Like, for instance, they just changed one of our SUD laws. So now we have to go through and change all of our policies and procedures pertaining to this one SUD law and, this one little section. So I think trying to keep up with those types of things is really, it's really been something that I'm trying to work on more. But policies are constantly changing, not only at the state level, the federal level. And then also sometimes, with me being in the global leadership program, I look at the global level too, to try to make sure I have all aspects covered. But I would probably say, policies and procedures, and then, also sometimes bridging those those relationships with communities. A big part of mine was during COVID. And when I took over the position, we had very, very poor standing in the community, and our relationships were lacking in a lot of areas. So it was really hard for me to get into some of these organizations and, make them believe that, HRC is really in it for the long haul. And, we're trying to do our best to see what we can do for them. But that is probably the second biggest, hardest one was, bridging those gaps between the, stakeholders, the community members and everything like that, and trying to change their mind and realize that we aren't the same HRC that we used to be. So policies, procedures, and just, community members and, advocating for our program and having them believe what I'm trying to tell them has been really difficult for me lately.
All right, thanks very much for that. So turning kind of more to the public administration realm, if you could talk a little bit about, and we'll again start with Dan, if you could talk a little bit about how any relevance you've seen, between kind of your study of public administration and then the work.
Sure, yeah. I found this over the course of both my jobs after I finished my master's, and don't underestimate your knowledge of just how the process works, of how government works, and understanding just bare bones why things happen the way they do. I mean, maybe you wouldn't be shocked, but I'm always shocked when people don't know how many senators we have in the state of Indiana, like federal senators. There's two. Let alone don't even get started on the state, how many state senators there are and state reps. I mean, and so at both spots, and now that I'm government affairs, it's expected for me to know that. But even so, just like in normal life as well as in professional life, people don't understand how the process works, and you might not understand that and understand why that's important until you kind of get out in the real world and you see, like Ashley was talking about, all the different policies and the different rules that come out, like for HRC or even Union Hospital or any hospital. I mean, if they want to build a building, they got to walk through the process of getting the necessary permits, and who do they talk to for that. And so, I mean, if you work for a smaller nonprofit, that may fall in your lap, and you're going to have to understand the best way to go about talking to the right people. So that's been very, very helpful in terms of really just knowing at least where to start, where to look for the right information, because a lot of people really don't understand just bare bones how government works, let alone whether or not the government is doing a good job, which I know, like public administration wise, you're learning about different ways to combat different issues. But I think that's something that I definitely lean on, and people ask me all the time about different things. So and where to find the information. Data is king, right? So where you can find data is instrumental when you're trying to make a case for whatever. So those two things, I think I would highlight for sure.
Great, thanks very much, Dan. So same question to Ashley. Concepts from public administration that you've applied to your current work.
Hands down, accountability is still another one that I'm really, really big on. I remember my first paper that I did in my master's program was on accountability. So that's going to be the main one. And then secondly, kind of like what Dan said, the MPA program helped me understand why policies are made, the history behind them, the reasoning for them, how to do them. Those are big for me. I have to learn my policies and procedures, and I have to tell people this is how it's done. And they ask why. Why is it like this? I've learned how to go through and search for these things. I'm more comfortable with, government, websites, looking information like that. But the bare bones, like Dan said, it's why we do these things, how we do these things, and stripping it away to where, if I have to make a policy or if I have to, implement a program or like something for me to get my HR programs better, I have that ability because of, my undergrad and the MPA program, because of, like Dr. Myers and things like that. It's those types of things that have really made a difference for me. And, you know, I think accountability, I'm going to have to get that tattooed or put it somewhere on my wall so that people know that, you know, I'm so big on accountability still.
All right, well, we're still talking about it, so we haven't given up on the quest to emphasize that for sure.
Not to brag.
Is there the next question, going back to Dan, is there anything from your time in the MPA program, and it could be, you know, information from a class or even like an experience that you had, but what is kind of the thing that, or it could be multiple things you took away from the MPA program that is kind of carried through the different stages of your career since then?
Yeah, I think like conceptually understanding like different tools in your toolbox, right? You may not be crazy about stats or research, but to know how it's supposed to be done is really, really important if you're getting into, you know, and I don't want to call it the real world, but the professional world, like the administrative type level, and Ashley knows this too, right? You need to know, like different studies will come out, and being able to just say how big of a deal is this or not, and then understanding just research in general, where people get their information is obviously really important. So those things have always stuck with me, just understanding how stats work and the research works. And I also, in my current job, I think back to different case studies we did on how public administrators operate, and different ways of seeing a problem through that lens, and then like in your own work, in your own life, how quite often, I hate to say it, but I'm sure we all can agree, quite often the administrator does a really bad job, and you're like, didn't have to be like that, you know, you could have done X, Y, and Z, and done. And I was working at Union Hospital in Terre Haute during COVID when Ashley started working at HRC, and I remember they did a really good job keeping employees informed of everything that was going on when COVID hit, you know, so nobody knew what was going on. And so it was very transparent. And now I'd like, and I remember telling everybody, hey, keep that up. Like, that's how you kind of keep everybody, you know, from jumping off the ship. But at the same time, like, even when I'm at the State House and people are testifying, I'm like, that is not the best way to go about what you're trying to do. So, yeah, I think that those different tools in the toolbox is how I view it, and certainly very handy.
Thanks, Dan. So, same question to Ashley. Things from the program that have stuck with you, whether it's concepts or theories, experiences, whatever the case might be.
There are a couple actually. So one of the things that I really rely heavily on, that I don't really, you know, realize and things like that, was my human resource development class. And so during my MBA program, they taught me how to build programs, how to do training programs, how to do it step by step, you know, like our SWOT analysis and things like that. So those training programs were really beneficial for me when I took that class. So that one was a big one. I learned to implement training things and doing those types of things almost effortlessly, if that makes any sense, because of, you know, that class that I had, because I can come in and do any training program, any policy program. I can make booklets of things for development, things like that. So that's a big one for me. And then, you know, and I've mentioned it before, when we did our pandemic, so Dr. Myers and I, we did a pandemic video, like the game for during our MBA program. So this was right before the pandemic hit, and we did a lot of what if scenarios, like who, and, you know, things and like that. And then the pandemic hit, and it's like, I can actually utilize a lot of these things, you know, during that time. I remember hearing Dr. Myers, you know, what would this person do and how would we do with that? So that was really influential for me. And starting in the pandemic and going from there, I had that mind frame and that mindset of, there are so many different things and places that we have to look for, like CDC, WHO, Those are some main things that I learned, and those names I learned a lot in the MPA program and during that whole time of doing the pandemicing with you. So you kind of helped start that foundation of my pandemic work, if that makes any sense.
Yeah, no, that makes perfect sense. And yeah, just a little bit more background. Here at the university, we have this program, and it's primarily for new undergraduate students coming in. So it's called the Sycamore Undergraduate Research Fellowship, or SURF. So these new undergraduates come in and they get assigned a faculty member. So I had a student come in as a SURF student, and the project that we were working on was developing a simulation about how government would respond to pandemics. And it was using the game Pandemic as sort of the foundation for that. And then I involved Ashley, who was a graduate assistant, and another graduate assistant, Yasmin Haiti, who was actually on a different panel, a previous panel to this one, and another graduate student named Jason Collins. So it was 3 graduate students and then a new, undergraduate student, and kind of not only were they doing the simulation as students, but they were also helping to develop the simulation. And we did, unbeknownst to us, touch upon a lot of topics related to public policy and pandemics that would end up becoming very relevant, unfortunately, in 2020. But yeah, so it was a memorable experience for me, and I think it was a memorable experience for everybody who participated. And of those who participated, the undergraduate student ended up going to law school, and now all 3 of the MPA students are pursuing doctoral degrees. So I don't know that means anything. I think it's just a coincidence, probably. But it's kind of interesting. So the next question that I would ask, though, and this kind of piggybacks a little bit off of what Dan was saying as far as research. Obviously, being at a university, being an academic by trade, we think a lot about research and involving students in research, and what is relevant to research. So I'd like to ask each of you if there is a particular topic related to your area that you could ask, like a research team, like, I'd like you to look at this research question and see what you can find out, or look at this research question and collect some data and do some analysis. What research question would you direct that team to look at? So we'll start with Dan.
I mean, that's a great question. The sky's the limit. Like, initially, I want to know why. I would love to know, like, the tax revenue distribution between locality, state, and federal, and how that's changed over the years. Like that would be a personal something that I would ask, just because I feel like so many rural communities are so starved for revenue, for tax revenue, and yet I feel like as a society we're all paying. I would imagine, again, this is the question, how much of that is going to the state and federal government versus how much is it being kept here, and what it used to be. Just because while population has declined in rural communities, certainly, I feel like the amount of population decline does not match up to the amount of revenue decline. So personally, that would be something that I would like to see some more research on. And then it kind of in my industry, and this is for rural communities kind of broadly, talent retention strategies specific to workforce in the healthcare realm would be really interesting, kind of outside the box ideas. How, and then also, and this may be a couple of years too early, but the state passed a law this past year that allows local taxing entities to create a local option income tax that would supplement rural hospitals. So like a county would levy a local option income tax, and then that money would be given to the hospital to keep their doors open, which used to be done through the property tax, but now we have property tax caps, and we won't get down that road right now. But at the same time, how kind of the public arena is helping stand up the healthcare in their community. There's tons of research that shows like when a rural hospital closes, it's incredibly detrimental to a rural community. And it makes it that much more difficult to attract people to stay or future industry to come if there's no healthcare available, let alone the actual health outcomes. So how kind of the local public entity can help support the healthcare industry. Again, it doesn't have to be just money. It could be some sort of talent retention efforts or something like that.
Those are all really interesting options. Ashley, what about you? What research would you ask this hypothetical research team to look at?
Oh goodness. I just want to mention, Dan, so my dissertation is actually on employee satisfaction retention using John Cotter's model for rural communities. So I'm just letting you know I'm on that aspect for you already. I would honestly say pandemic relief, policies about the pandemic, how we can improve pandemic policies. A big part of us for our issues during pandemics, I couldn't give telehealth services over state lines. So I think that would be really interesting to see what the consequences of that were due to us not being able to do that. Looking at policies for the future, for future pandemics, because, once one pandemic has happened, it's bound to happen again. Better preparedness, like PPE, that's something that we looked at when we were doing some of our work. PPE was very, very hard to come by. I mean, very beginning, we ran out of masks often. We ran out of spray. We ran out of all our cleaning supplies that the federal government was giving us. We ran out of that relatively quick. So I would say pandemic policies, even like client satisfaction, like my dissertation is more on employee satisfaction and retention, but I think client satisfaction and how those consequences of not having the ability to do services in another state, that'd be really interesting to see, especially because I'm from Illinois. So even though I have a lot of contacts in Indiana, I couldn't refer them over there. I couldn't give them services because of those policies and those lines that I could not cross.
Great, thank you very much. So before we move into the final question that I had for you both, I did want to ask a few follow-up questions based on some things you touched on. And I do want to say for anybody, any audience members in the Zoom, if you want to type a question into the chat room, I'd be happy to take those questions as well. So feel free to jump into the chat room if you'd like to, if you have a question for either Dan or Ashley or both. So the first kind of follow-up question is for Dan. And Dan, you'd mentioned, how you look at like a variety of sources to sort of keep track of policy at the state level and federal level. So if there was, if somebody was interested, somebody watching this was interested in kind of tracking health policy and looking for some different sources to use to get that information, what sources might you direct that person to? Are there any particular, particularly good sources for health policy information or the type of information that you're tracking on a daily basis?
Yeah, sure. So a lot of my information is not what you would probably call, or if you were looking for some sort of research, you don't necessarily want to do what I do in terms of I'm not keeping up with the latest studies that are coming out or latest journals that are coming out. Rather, I'm looking more industry specific kind of updates. So I cast a really wide net and and then kind of try and filter out the best I can. So I do a lot of the national big names. I've got a subscription to the Wall Street Journal. They'll have some healthcare stuff in there as well. But like I said, you got to keep up to date with what's going on everywhere, right? So I subscribe there. I read a couple websites that have a regular newsletter just about what's happening on the ground on the federal level, just to keep up to date on that, because it is it's like I said, it's important for my job to know these things, but also I get asked by different people about, what do you think about this? What do you think about that? And I don't want to say, what are you talking about? Because then they're like, what's your job? So at the same time, I need to stay up to date on that stuff. And then kind of specific to what I look at, or what I put a high priority on, are kind of like the organizations that have been around a really long time. So on a national level, specifically for rural health, I look at the National Rural Health Association, which is not a surprise. They've put a lot of effort into beefing up what they do. If you're interested in some sort of industry specific thing, I guarantee there's some sort of member association out there that's probably doing this. So get a hold of them, and if you can afford it, if you're still a student, a lot of times students are free. You can get in there for free and participate that way. So I would say industry specific kind of updates, those come through on a weekly, if not daily basis. So keeping up with that is what I do. And then kind of like the third, in my mind, like level, are the paid subscriptions that are specific to state engagement. So there's a lot of stuff out of Indianapolis that I pay for and I read whenever it comes out. Some of it's not that expensive. Some of it is really quite expensive. And it has like some really tight copyright things because like people are putting in a ton of work. So one of those one's called Legislative Insight. And it's available if people want to pay for it. And it gets very deep into many different things. And that comes out weekly, and I have to take almost half a day to read it. It is pretty intense. And then there's a lot of good free stuff as well on the state level. The Indiana Capitol Chronicle does a really good job keeping up to date on stuff. So yeah, I hope that answered your question.
Yeah, no, absolutely it does. Thank you. I will hand it off to Ashley too. Is there, in trying to sort of keep up to date with what's going on in your field or in your particular area, like geographic area, are there any particular news sources that you rely on as far as policy or changing, mental health issues?
Not like specifically local to me, but honestly, a lot of my information and things that get sent to me are from like my HR department. They're very good about keeping up with all the policies and procedures that are coming out. But a lot of my things that I am reading are, policies and procedures, the state websites. I'm on the National Institute of Health a lot. I know they have a lot of a lot of articles and things like that I go to, and I use them a lot. Like CDC, I'm on the CDC website all the time looking at regulations, or like the World Health Organization. Those are some of the main ones that I have to look at. Occasionally, I do have to look at like our local, like Edgar County and Clark County with their public health departments and things like that, just to see what their COVID levels are and stuff. But a lot of them are local, or just information that's sent to me by my HR department, or policies and procedures that are changing on the state and local level that I'm having to look at. So some of the main ones that I look at are just, CDC and WHO. I know that sounds really lame, but I'm on those daily.
During COVID, I think we were all checking on the CDC pretty regularly. I think we've probably gotten out of that habit at this point for the most part, but it never hurts to keep up with that. So my next follow-up question is for Ashley more specifically, because you referenced, being in the global leadership program and your dissertation. So if you'd like to talk a little bit more about, that, I guess, maybe how that program in general has informed how you're doing your work in the healthcare sector and how your dissertation research relates to the kind of work that you're doing?
Absolutely. So with the Global Leadership Program from St. Mary's, I'm in the inaugural class. So we are kind of like that class that kind of gets to guide the future dissertation classes and things like that. Doing the PhD has been probably one of the best things. I've matured so much being in this program. It has allowed me to work on a global level. A lot of our work is done overseas with like Medicare, like medical device companies or other companies trying to work and do their HR programs. The best way for me to explain my global leadership program is it's administration on the next level. That's how I explain it to everybody. I've had some really great leaders in this program that have taught me how to lead and look at things globally, but also promote them to where it's, locally as well. Through this program, I've published a lot of information. I've done a lot of with the International Leader Association. That one's a big one that we use, and we do a lot of presentations there. It's also helped me. So with this program, we also work with the Terre Haute Symphony Orchestra. We do their annual reports last year, and this year we'll do it again as well. It's helped me get into the community more outside of the state of Illinois, to be quite honest. I'm in Indiana. I'm in Terre Haute a lot. I'm over there, and I'm working with a lot of different students. Being with this program has probably been one of the best things that I could have ever done. I have so many different connections and different, viewpoints that I didn't have previously. I had just finished my coursework. So it's 3 years of coursework, continuous 3 years. We were taking 1 to 2 breaks, but that's about it. So in my dissertation, I can actually tell you my dissertation title is. It's finally on there. So my dissertation is From Crisis to Opportunity, Navigating Overnight Change while Leveraging John Cotter's change model to improve and boost employee satisfaction amidst and after the COVID pandemic. So a little backstory. So my company, we had almost 605 individuals waiting just for services at the height of pandemic. Through my global leadership program, I was able to take some of what I learned in my MPA and put it on a global level to implement John Cotter's program into my own organization to where we funnel clients now through different programs. So instead of having them come to me first and then we do it everywhere else, we get their needs met from the very beginning. And John Cotter's 8-step change has been really, really big. And Dan, I honestly, it's something you might want to look out for when you want to make changes, in your organization or even, whatever it may be. But that's a big one that you might want to look at. But I've matured so much. Dr. Myers, you can attest this, and I'm a lot more mature than what I used to be and how I talk and things like that. So this PhD program has literally been one of the best things for me. I've made connections. I have improved my career. I've published so many things, and I'm working on a dissertation that I never thought I would be able to do. So I get to be a doctor, and I never thought I'd get to be a doctor. So I hope that answered it for you, Dr. Myers.
Yes, no, very good. So, and I don't know if you mentioned it specifically. It's at St. Mary of the Woods.
Yes, St. Mary's Wood College. And Dr. Kim Lacomba is the individual that anybody wants to reach out. They can go with, they can reach out to her. And honestly, for a PhD program, it's actually really, really priced, relevant for working adults and students. So I would highly consider it for anybody.
So thanks, Ashley, for that. And so my next follow-up question is to Dan. So you had mentioned kind of some controversies about the cost of healthcare in the state of Indiana, and I was wondering, without getting into, because you mentioned it was kind of a hot button political issue, and I don't want to put you in a tight spot or anything, but if you could talk just in general terms about why there's been this controversy about healthcare costs in the state recently.
Yep. So not surprising to anybody, healthcare is really expensive. It's been expensive for a while. Just about every aspect of it seems to be getting more expensive. And the state of Indiana how do I'll phrase this as best I can. There was a study completed that looked at the cost of healthcare, specifically at hospitals, and compared the state costs across states as a percentage of Medicare. It was the RAND study, and there's a RAND 5.0 now, and it's been out. So when that study came out, and the study's flawed, but that's besides the point. It's really, really difficult to compare healthcare prices. And I'm not saying that the RAND folks, when they did the study, obviously they're very smart and they're smarter than me. They figured out a way to compare healthcare prices in a way that they felt was as best as they could. It's just really difficult to actually encapsulate the cost of providing healthcare, but they did it as best as they could. And when that came out, Indiana's hospital prices were like the top 3 or so in the country, which then that set off alarm bells at the State House to try and take some action to decrease the cost of healthcare. And that's been an ongoing discussion. Did somebody say something? No, okay. That's been an ongoing discussion at the State House for, I don't know, 4, 5, 6 years, something like that, when it comes to decreasing the cost of healthcare for consumers. Everybody uses healthcare and it is not cheap. So I think like that discussion, while I think most hospitals executives would tell you, yes, healthcare is too expensive. But if we're really going to decrease the cost to the consumer, everybody needs to come to the table, meaning the healthcare provider, the facilities, pharmaceutical, insurance plan, health plans, Medicaid, everybody needs to come to the table and have some transparency. And a lot of people in our industry feel like a lot of that's been heavy-handed on the hospital end and not necessarily been felt the need to enact transparency or different regulations across other actors in the healthcare space. I hope that makes sense. So, it's a discussion that's continuing to ongoing. And, I've got 3 kids, so I mean, I know healthcare is really expensive, but at the same time, I've got members who are literally just trying to keep their doors open, and it's expensive to provide healthcare, and somebody has to pay the bill. And at the end of the day, I think that is where the conversation needs to go, in terms of somebody needs to pay the bill. Nobody wants it to fall totally on the consumer. That's why they have health insurance. So where does health insurance play into this? Also, Medicaid reimbursement's incredibly low. Where does that play into this? If that were to go up, maybe the cost of healthcare would decrease to commercial payers and things like that. So it's a really complicated discussion, and one that, again, I'm sure will come up this year. It's come up for quite a while.
Thanks, Dan, for that. So I was curious as you were talking, because you had mentioned kind of the issue of talent retention. And I was curious if there could be a connection between Indiana having higher, or apparently higher, healthcare costs, and just because I've been a member of some different groups, like the West Central Indiana Area Health Education Center and organizations like that specifically try to cultivate the healthcare workforce in rural areas in different ways. And I was just wondering, could there be a connection between kind of difficulties getting providers to practice in rural areas and Indiana having higher healthcare costs, since Indiana is primarily rural? Do you think there's a connection there potentially?
Well, certainly. I think like it's not a direct correlation, but the connection for higher healthcare costs come in when the patients are on average sicker, their chronic diseases have not been managed. It's they've delayed care for whatever reason. They probably couldn't, again, like you said, there's no doctor in the area, so they delayed care. So something that could have been taken care of, by a primary care visit with maybe, a couple weeks of antibiotics that cost $5, $10 is now all of a sudden a 2-week hospital stay for an infection, right? So things like that certainly do impact the cost of care. And as a state, we are generally unhealthier compared to our neighbors and many other states across the country. So that certainly plays into it as well. And there was one other point that I wanted to make, but it just escaped. But yeah, the cost issue, a big issue of the cost discussion, and rightfully so. Again, I don't want to say that healthcare is not expensive, because it is. But in Indiana, we have a very high percentage of individuals who work for businesses who self-fund their health insurance plans. So that's coming straight out of the business owner's pocket, and nobody wants that, right? So like that, I think that's driving the discussion more than just about anything else. Because yeah, I mean, nobody wants, the small businesses to have to foot the bill, and nobody wants to have the consumer fit the bill, but again, somebody has to pay for it. So yeah, no, I think that you make a really good point, Dr. Myers. I do think that there's certainly a correlation there, especially when we have so many patients in rural communities with comorbidities, asthma, diabetes, heart issues, mobility issues, and things like that. All that compounds, and it just makes it a lot more complicated.
So I'll go over to Ashley for a second. I'm curious, from because you're across the border in Illinois, not very far across the border, but you are in a different state. So as far as healthcare costs, is that something that's complicated any of your work as far as placing patients and getting them treatment and things like that?
Absolutely. So with us being grant-based funded, a majority of my clients are Medicaid, Medicare clients. It does make it difficult. I think placing clients is a lot more difficult when you have, like I have therapists who are only master's level and bachelor's level. Like I have some clients who can't even see a bachelor's level because they can't take their insurance. So my perspective on my end, it's not necessarily about that. Mine is about like credentialing and making sure people can see the appropriate people without having them pay. But I think being over in my type of work, I have the ability to do like hardship adjustments, or have the ability to do like sliding fee scales. So in my type of work, it's much easier for me to get that cost down for clients if they're willing to bring in the stuff. So I think a lot of it has to do with insurances and those types of things, and paying for things. Like right now, one of the big things that we're battling is like we have now started with our EAP with like Terre Haute and other places. We have some clients who have insurance deductibles up to $7,000 or $8,000 just per person. And so that's a big one for us too, is like we have clients who need the services, but they have such a high deductible that we have to do a whole 2-3 other new things just to get them in and to get that price down very, very low for them. So I think my thing, it is, healthcare costs are very expensive. Just for 1 hour of service with us is $300 per hour. And then an individual service is for like a group session is $100 per hour. Not everybody's going to be able to pay those if they don't have the services. And that's a rising cost. We've raised our costs twice since I've been here in 4 years, just because we have to make it sustainable for our organization to live. But I do think it's going to pay a big part into it. It's played a big part now. I'm constantly fighting with people, not negatively, but trying to tell them like, hey, this is your insurance. This is why you have this cost. And so that's a big one. And also people who make too much money to get state insurance, but they don't make enough money to pay for their private insurance with their work. That's a big one we're battling now, is that I am very big on getting insurance for individuals, and I'm constantly having individuals turned down because they make too much, but they can't make enough to get their insurance through their workplace. So that's a lot of what we're looking at now, is things are so expensive, and getting mental health costs are really expensive. And Dan knows how that is, trying to field those calls of trying to get individuals who are mad or upset, but prices are big and they're still rising weekly. like you can't stop the prices from going up because it's just how it's the nature of the business, I guess.
Thanks very much for that. So the kind of the last follow-up question I wanted to ask, because I mean a theme through some of, I mean, obviously through this discussion and through some of the previous discussions that I've had with some of the other MPA graduates is kind of the challenge of rural areas, and I think that came across pretty clearly in things that Dan said and things that Ashley's talked about as well. So whether it's specifically a healthcare issue or if it's kind of a broader issue, because Dan mentioned kind of getting policymakers to really focus on rural subject matter, particularly at the federal level, can be challenging. So if there was one specific aspect of living in a rural area that you would like any and all levels of government to really focus on improving, like what would you say to federal officials, state officials, we need to fix this about rural areas. So Dan, what are your thoughts on that?
It's a really good question. I think kind of, I'm going to cheat and kind of give you two. One is infrastructure. Trying to figure out ways and infrastructure / revenue, right? At one point, local communities were able to keep up with their infrastructure with the money that they had, and now they can't. So why? Like answering that question, why? And yes, people say it's people don't make as much money and like per capita compared to the suburban and rural, or sorry, suburban and urban. But why? Why is revenue such an issue when it didn't always used to be like that? And kind of like my second thing that I would really want people to take a look at, especially in the state of Indiana, is schools, public schools. Looking at, again, that I hate to come back to revenue, but I mean this is public administration, so I mean at the same time understanding how do we fund our rural schools in a way that keeps them competitive. I mean, if you want to see a rural community suffer, close their healthcare facility. If you want to see a rural community become a ghost town, close the school. So I think at the same time, almost in a way, like looking at schools in a way, in a manner to kind of build that, like, and you talk about this in pandemic preparedness, right? Resiliency and different ways of becoming more sustainable. And schools play a huge part in that, a huge part in retention, in a way that people can see kind of progress. And now it's becoming easier and easier to bring in so many different subjects for kids to learn, whether or not the teacher's there. But at the same time, it comes, how are the facilities? Are people engaged? So yeah, I think that those two kind of off the bat come to mind.
Thanks very much. Ashley?
I would say people. How can we help people? How can you guys do policies to help us help people better? My big thing is we are here to help people. I need the policies and procedures to allow me to help people, to give us the ability to do more things, to be quite honest. We need that ability to give more services, give people more resources, anything that they may need. One of the biggest things that I have learned through pandemic and seeing people and individuals is they need somebody to talk to. They need somebody to listen. They need somebody who's going to be there. And we need to make sure that we're doing everything that we can for them and making sure that their needs are met and taken care of. And that's a big thing that I'm really big on is people. I want policies and procedures to benefit them better. I want these people who are making the rules and regulations, I want them to come to my rural mental health facility and see what the individuals we're dealing with on a daily basis. They're making policies and procedures for one size fits all, and it's not going to work that way. You know, we're constantly changing. The world is changing. Communities are changing. And I think the policies and procedures need to change with the people. And so that's a big one, is looking at how we can help people better and help benefit from these things.
Thanks very much, Libby, for addressing that. So the last prepared question that I had, and again, if anybody wants to jump into the chat room for a last minute question, feel free to do that. But the last question that I have is there anything you would like to add that someone aspiring to your profession should know? So we'll start with Dan. So if you were giving advice to somebody who wanted to eventually get a position like the one that you're holding right now, what advice would you give to them?
I think you need to come at whatever it is honestly. Don't try and have secret agendas. Legislators can see right through it. So come at it honestly. Do the right things the right way. You know, that's definitely one thing that I've learned. The details matter. And just experience. You know, if you've never been to a committee hearing, or if you've never been through testifying on a bill or something like that, like the only way you're ever going to learn is just by doing it. And that's just how it is. You may get chewed up. You know, you may just get in and get out. It just depends. And really immerse yourself in whatever it is that you're supposed to be discussing. Try as best you can to learn as much as you can about it. Legislators really look to subject matter experts to help solve problems. They want to solve problems, but you need to educate them on what they are. And then lastly, and I think this speaks to like the whole public administration program, and I tell this to my family members, like right now we're in the middle of a presidential election season. So everything is what happens during a presidential election season. So it's kind of like people, I can't watch that because I get too riled up, or I can't do that because I get too riled up, and people are like, how do you do your job, and how do you get involved in politics and deal with all that? And I just tell them, and it's the honest to God truth, is I love the process. I love the process. I think we have a great way of doing things around here in America when it comes to making laws, and certainly it could be better, and certainly it's too slow at times. But I think it's fascinating. It's theater almost, right? You kind of see how people react, and you kind of try and see around the corner as to what somebody's trying to do. So I would tell some, if they're looking for something like what I'm doing, is learn to love it. Learn. And I had a moment, this past Indiana session was my first one at the State House, and it was towards the end of it, and I was kind of burnt out, and I was talking to our lobbyist who's been doing this for a very long time, and I was like, somebody came up and they were like, they're bringing that bill back up, and it was a bad bill, and I was like, why are they doing that? And I'm like, if they do this, then we're toast, and blah blah blah. Like, I was just kind of having a prima donna moment, melting down in front of her. And she kind of just like, she's like, and I was like, what are we going to do if they bring that bill up? And she's like, we'll do what we do every day. We'll get it taken down. And I'm like, all right. Like talking you off the ledge in terms of just like, this is the process. We take it day by day. We know what we can do, what we can't do. And if they bring it up, then we'll get it taken down. And if we can't get it taken down, we'll try the next step to get it taken down. So I would say that's what I've learned, and I would share with somebody.
All right. And Ashley, same question to you. Piece of advice you would give to someone aspiring to your position doing the work that you do?
Yes, don't do it for the money. You can't come into this type of work and actually expect to be paid well. I mean, you have to honestly do it. You have to love it, like Dan said. Another one thing is think outside the box. I never would have thought that I would be a director for a mental health and substance use facility in Edgar County. Not at all. My viewpoints were like, I'm going to be in public administration. I'm going to, do work for the government, things like that. No, I didn't. I'm in a mental health facility. Think outside the box. Like I've had interviews with different organizations, different universities for like HIPAA coordinator or, like different things that you wouldn't think of. Don't think that you're having a public administration, you have to go into like a government job. Think outside the box. There's so many different, avenues that you can explore being an NPA student. And I want people to realize that don't be afraid to do something that you normally wouldn't do. Mental health is something that would probably scare the crap out of me if I would have thought I was going to do that when I started my NPA program. Now I love it. I love seeing clients. I love working with our disability program over in Paris. I love having clients there as well. And it's don't put yourself in a box and make it so like small. Open your mind to work for any place, anywhere. I've worked really well with I've had job offers from like probation offices, things like that. Places that know that the policies, procedures, and you can follow them, go for those places. But hands down, if you want to work in my type of work, it's not going to be luxurious. You're not going to have lots of money. You're going to have clients who are going to love you or hate you, but it's worth it. It is one of the most rewarding jobs I've ever had. So, and that's it. And I hate to end my part of this, but I actually have a client to see, so I do have to log off now. But thank you guys so much for letting me come.
Oh, absolutely. Thanks for sharing your insights, and have a good rest of your day.
Bye, guys. Nice to meet you all.
So, Dan, we are going to go ahead and wrap up. I do usually ask the people participating, is there anything that I didn't ask or anything that you kind of wanted to say that you didn't have an opportunity to say in response to any of the other questions?
No, I think I think we covered so much. I like Ashley didn't think I'd ever be in healthcare, but here I am. But I would just tell people while you're in your studies, focus on that, but really, push yourself. If you think that you're not qualified for something, but it's what you want to do, figure out a way either to become qualified or get it. Don't just assume you can't do something because you can. I never thought I'd get this job, and here I am. So it's been great.
Well, thank you very much for taking time out of your day to share your insights and your experiences with everybody. So just to wrap up, again, my name is Nathan Myers. I'm the MPA Director, Master of Public Administration Director at Indiana State. I'm in the Department of Political Science. So if you're watching this is going to be published on YouTube and maybe published in other places as well. So if you're watching this or listening to this and you want more information, feel free to contact me, through the university. If you go to the website and look up the Department of Political Science, I'm easy to find. But again, thanks to our panelists, Dan Hardesty and Ashley Hemrich for their discussion today. And again, if you have any questions, let me know. In the meantime, have a good rest of your day.
Thank you.